I'm Dr. Doug Bartels, an orthopedic surgeon and sports medicine physician with Mayo Clinic Health System, and I'm here to address some questions you have about ACL injuries. It's changed a lot, as have most things in sports medicine. So there are still some things that we do that require, big open surgery, but things like ACL reconstruction have moved to be pretty minimally invasive. And it really depends on the type. There's a lot of nuance about the type of what you use to do the reconstruction of the actual ACL. But oftentimes we can do that through a couple of small incisions, even as small as something like this, and a couple little poke holes for the arthroscopy camera. Most of what we do with ACL reconstruction is done through arthroscopy, so using the little camera to actually visualize, and a lot of that work can be done through pretty small incisions. So we've come a long way, and most of it is pretty minimally invasive these days. Yeah, so it's a big surgery and a pretty long recovery. And so, in terms of the actual surgery itself, most often it's done in an outpatient setting. The procedure itself takes, an hour or so, usually, depending on whether or not we have to fix other things within the actual joint that you may have injured at the time when you sustained the injury. But it's usually done on an outpatient basis, takes a couple of hours, and oftentimes less than that, depending on what we have to do when we're in surgery. You're usually in a brace right after surgery, but if we're just having to do an ACL reconstruction, I allow my patients to get up, stand, work on range of motion right away, start walking with the assistance of crutches usually. But then pretty quickly, most patients, once the muscles start to wake back up, can transition away from the crutches. We get people enrolled in physical therapy right away to start working on range of motion, getting all those muscles to wake that back up, kind of reteaching people how to walk is something as simple as that. And then we transition people through multiple phases in terms of the rehab process. And as as our patients demonstrate good range of motion strength, we allow them to get on a stationary bike, and then we move from a stationary bike to return to jogging program. And then, once they are able to do all of that, we introduce some sports-specific things if they're involved in athletics. Usually the full recovery process is a long time though, so if it's one of my athletes that's looking to get back into organized sports, it's close to a 9-month rehab process. Yeah, there are risks with any surgery that we do, which is why we take them all very, very seriously. It doesn't matter if it's a simple knee scope all the way to a multi-ligament reconstruction around the knee. The main things that I like to counsel people on after ACL reconstruction specifically are stiffness after surgery. There's always the potential that the graft could re-tear. Infection is always a possibility, or damage to some of the blood vessels or nerves that live around the knee. The fortunate thing is that all of those are really, really low. So, all in all, the risks are pretty minimal, but those are some of the common ones that we experience after surgery. But again, they're pretty low. Yeah, physical therapy is huge, and I'll often say that your kind of work in the rehabilitation process can really make or break the surgery. I can do a really good surgery, but if we're not all bought in, me, myself, the patient, the physical therapist, in terms of rehabbing it appropriately, then a not great outcome is possible. So I rely heavily on our team of physical therapists here. We have a set of protocols that we've done a lot of research on to make sure that we're up to date in terms of the literature. And if someone is lagging behind, the nice thing about Mayo is that they know how to reach me very easily. And so if there's someone that they have a question about or concern, or just want to say how great they're doing, then they can send me a message really, really easily, and we can chat about their progress. And the nice thing about the therapist is that they can get hard quantifiable numbers about how patients are doing through some of the functional testing that we do that lets us know that this person has done a great job of getting their strength back. It's almost as near symmetric compared to the other side. And we use that information to kind of guide return to play. So our physical therapists are huge in terms of rehab after ACL surgery. To learn more, please click on one of the links on the screen or in the description below.